Okay, so you got some low back pain and you want to cup yourself. See if you can relieve some of that. So let's see what we can do for that. You got your cup here. I recommend using the largest ones that you can fit on the area. That way you can get the most bang for your buck. Get yourself a little something to help with the friction. So some aloe vera gel or some lotion will work fine. This is just ultrasound gel. We'll use a towel here just to keep it clean. Got yourself your pneumatic pump here. Keep the hose on it. That will make it easier to reach your own back. Just tuck a towel here so I don't get any of the gel on the clothes. A little bit of the gel on there. One of the cups, you can just move it around so that way it's all over there. Good. Got your cup on here like this. You want to try and go, my spine, the bones themselves are right here in the middle. I try and go just to the side of that. Here, push on, get firm contact, pump. You should see or feel the tissue going into the cup. Pump it as much as you can tolerate. Move straight off. Do the same thing on the other side. Just going to go up the back. If you can't reach your own back, you can have someone else do it for you. There we go. We got nice cups on there. It's purling pretty aggressively. So now, if you can tolerate it, ideally, you'd like to bend forward and let it relax the back. Try and keep your knees straight. Try and loosen the back there. Hold it for a few seconds. Come out of it. If it's too much to do that way, you can also sit down. Do it this way. Here. Go here. Flex forward. Go to what you can. Do this anywhere from 5 to 10 reps. To remove the cup, grab the little valve at the top and pull straight. That will release the air. The more purple, the darker it is, the more toxins it releases. Be sure and drink extra water or electrolytes, because this will dehydrate you. If you're having low back pain, the best things for you, this stretch right here. Call it a prone on elbow stretch. You're here, go up here, go up on your elbows, relax. Let a nice curve happen here in your low back. If it's causing an increase in pain or symptoms, you're too high. Decrease a little bit, make it tolerable. Eventually you want to work up to here being pain-free or just a stretch. But if it's hurting, lower down. If it's bothering your neck or shoulders, grab a pillow or two, put that under there and you can hug here and just relax. Stay in this position for anywhere from 2 to 5 minutes. Nice and relaxed. Follow it with a child's pose stretch, nice and easy, into this position. Hold it for 30 seconds. Go off to the side. Other side. Those two are super helpful for keeping it loose. If you're really stiff, flip over here, do some lower trunk rotations like this. Really help loosen that low back for you. If your mid back is also a little stiff, you can get on your side here. Do some open book rotations like this. Try and keep your knees together. Try and keep your shoulders down. Try and do 5 to 10 reps of those. That will keep the stiffness at bay. Another great way to increase your flexibility for the low back and mid back, get your foam roller, put it here, stick a pillow over it. Get here, keep your hips relaxed. Start kind of the bottom of your rib cage, support your head and neck. Gently round over the roller, exhale. Let that release. Come up, scoot down an inch, do it again. And do this every level. Up to your shoulders here. Keeping your hips down. If that's too easy or it's not getting enough, take the pillow out. Try and get to this position. Hips down, head and shoulders down, no pain. If you're really dealing with long-term back pain, stiffness, chronic, long-term, you could go to the advanced version. You put this now under your low back. Drop your hips over the roller. So I'm on the roller on my low back. I'm going to gently try and pull my hips around the roller like this. Now I can feel it stretch in the low back. I can drop my knees side to side. Just nice and easy. This is a lot more aggressive. So if you're in a lot of pain and not so much stiffness, it's probably not for you. But if you're in a lot of stiffness every day, it's just stiff all the time, this will really help you out. And you just do this for anywhere from 3 to 5 minutes, same as the other one. Just like this. Down. Okay. I can do a little bridge, roll it out of there. Now that you've mobilized it, you want to stabilize it, you want to strengthen the low back. Some of the best ways: straight, simple plank. First, start from your knees, make sure you can do it. Engage your core, pull your belly button in, your hips up. Keep your feet down, that's going to be the easiest. Lift your feet up, a little bit harder. Next level of difficulty, knees up to here. And try and hold it for 10 to 15 seconds. Start with those, make sure you can do those for a solid 30 seconds without pain. Then you could progress to more aggressive planking where you're either lifting one leg without twisting your hips, stepping out. Side planks, also very helpful. Make sure you're not in a V. Straighten yourself out. Bring yourself up from the knee. Don't rotate here, keep yourself above. You can add a side abduction here, or you could drop down, pull back up, drop down, pull back up. Whatever seems to be most comfortable and the level of appropriateness for you. Of course, do both sides. Keep it even. Bring your hips in line, hips up. If you're like this, you can of course do some bridging. Make sure you're leading with your glutes. Glutes going up first, not arching my back like that. I can do some push holds like this, push and hold. Feel my abdominals kick in. Push and hold. Low march here. Lift. Lift. Don't let your back arch. If you have a band, you can work on your clamshells here. Or even more effective, hold one straight, engage your core, open up, don't let this one move. A few sets of 10 to 15, 20 reps, same thing other side. Don't let your pelvis rotate. Don't want this happening. Keep that real stable. Another really good one, drop this down to your ankles. Same thing, stable hips here. Engage, step out, out, in, out, out. Make sure your knees don't drop in. Make sure your hips don't twist. Okay, hope that helped. Try those, put some comments, let me know how you like it, and we'll make another video.